Well, I'd like to say hello to everyone who's taken the time to join us on this call for this webinar. On behalf of the folks from CoLumbo, as well as Dr. Van Gotem and Dr. Broder, we thank you for being here with us today. And we're going to spend some time talking about how CoLumbo, the spine MRI co-pilot, impacts our ability to be more efficient and reduce burnout for our radiologists at the operator's console. So as you can see from the splash screen, who our speakers are going to be, I get the opportunity to talk about the fundamental challenge. And I think anyone involved in the healthcare enterprise, certainly within the imaging enterprise, knows that radiologists are probably amongst at the greatest degree of stress and risk for burnout over any of the specialists that we have in healthcare. And the question, for today is how can technology like this AI-driven technology in CoLumbo empower our staff, our radiologists in the healthcare enterprise, dealing with the fact that I think around the world we're dealing with an ever-increasing case burden and ever-increasing stress on our radiologists. So, these days in 2023, we look to artificial intelligence to help us in these areas. And what is AI? AI is essentially a technology that allows computers to emulate human capabilities. By the way, this is my one joke that I will tell. I think you can see my cats on the screen over there. I think hopefully you can see my mouse as well, and you can see my cat's cervical, thoracic, and lumbar spine right here. So in terms of what AI is able to do in spine imaging, there's a lot of areas that I feel very passionate about. But here today, we're going to talk about this AI tool that essentially leverages one of the great strengths of machine and deep learning, and that is the ability to do image segmentation. And you can see how this ability to segment essentially enables all the downstream technologies, which would be triage for imaging abnormalities, detection and characterization of imaging abnormalities. Now, here you can see a couple of screen grabs from the CoLumbo product. And frankly, you'll see much better erudition from the other speakers, but you can see again how the individual vertebral bodies are segmented and how that segmentation would allow you to identify a number of structures that we care to look at, like nerve roots and spinal canal dimensions and relative position of vertebral bodies and height of vertebral bodies. Here again is another screen save. Again, I don't really want to spend too much time stealing the thunder of my colleagues, but you can see how you can recognize the configuration of the vertebral body. You can identify the disc thecal sac margin. You can identify here in the axial plane the nerve roots, the actual herniation, as well as all the other critical structures that we look at in the spine. And frankly, leveraging all the way through, all of this capability for detection and segmentation and characterization, the ultimate expression of all of this is to pre-populate a report in a style that the user is comfortable with. And these are all tools that you'll hear about. But frankly, one of the biggest challenges we have in radiology is standardization. I tend to fill an administrative role, but anybody who serves as a lead for neuroradiology in their individual catchment area has suffered from the fact that one colleague may call something mild, it will be severe to another. One person may call it a bulge, the other person may call it a herniation. As a matter of fact, in this recent study, which was collected by the folks from CoLumbo, in designing their product for thresholding, they were given widely disparate guidance. One radiologist doesn't want to call a bulge unless it's 6 millimeters. The other one insists on being able to identify a bulge that's 3 millimeters. We'll only call a herniation if it's a certain size. So frankly, there are different desires from our radiologists. This gets expressed in different report quality, which then turns into a problem for the next radiologist who reads the study, who may read it differently, but it's a bigger problem for the patients because their referring doctor is going to get inconsistent results. One of the greatest benefits of a tool like this is it standardizes the product that comes out of your institution, and that has enormous value. So again, these tools essentially can make you more efficient and more productive and more supported to reducing the stress and burnout we alluded to earlier. That standardization is an enormous value add for your practice, so that a radiologist, that a surgeon, an orthopedic surgeon, or neurosurgeon, anyone who sends cases to your organization is going to get a consistent and standardized report. A bulge is going to be a bulge. A herniation is going to be a herniation, and a measurement is going to be consistent, because one of the things computers do really well is measure things appropriately. So again, supporting our radiologists by helping them get the work out faster, but also, again, assisting them in terms of confidence because they know they're not going to miss a herniation that the software can pick up. Now, the AI spine space may seem very crowded and very complicated, but if you look at it, if you filter out the companies that have not really approached or certainly have not achieved regulatory clearance, there are really only a few companies in this space, and as opposed to Siemens and ADOC and Zebra, where they have a limited range of pathology that they can detect and they have been approved for. The CoLumbo product is really approved for the diseases, the variety of diseases you see at the spine interface. So with that introduction, I would like to